Still, there's a lot of hopeful talk this week in terms of coming vaccines, when they'll be ready, how effective they're going to be, and who will be able to get them first.
A lot of talk about it, Jared. Some say, though, they don't want it at all. But a local volunteer who's in a vaccine trial wants to change their minds. He shares why he's taking the risk with our Brianna Whitney.
We're getting an exclusive look as to what participants in the Moderana vaccine trial have to go through. And this thing is quite involved. We're talking 25 months long, 6 clinical visits, and 25 phone calls. But this participant says it's all been worth it.
I want people to realize, this is how we get society moving again.
This Scottsdale man, who asked to stay anonymous, wanted to be a positive part of history in the most trying year of many people's lifetimes.
So the first time I went in, as I mentioned, we did kind of a full physical, and then they gave me my first injection. And that injection, I didn't know if it was going to be a placebo or if it was going to be the actual vaccine.
That was back in August. Then a month later, he went in for the second shot.
The next day, I was lethargic, like a cat. I had to just kind of lay low for a little bit for the first 6-7 hours in the morning, and then felt great the rest of the afternoon.
He says that's the only real side effect he had. The Moderna vaccine is 94.5% effective. Other companies like Pfizer are seeing similar numbers.
These efficacy rates are great. I think they're phenomenal, actually. They're probably as best as they could be.
Dr. Shad Marvasti says the vaccine trials are not only promising, but extremely important for targeting infection rates too.
Just like we want communities of Black and Brown to participate as well, because we want to be able to help those communities who have been disproportionately impacted.
But he says there are still some unknowns.
We don't know still whether or not it can prevent you from getting infected. We know it can prevent you from getting really sick, and that may be good enough.
But as somebody who received it, this participant says it's easy and safe and says everyone should get it once they can.
It's like vaccines or trying to rewrite how we live in society. You choose.
Brianna Whitney for Arizona's Family.